Magandang araw sa ating lahat. Magandang araw po Prof. Medrano and classmates. My chosen topic is COVID-19 and it is entitled Comparative Analysis of COVID-19 Responses of Abu Dhabi Government UAE versus Municipality of Negrillan La Union, Philippines, focusing on socio-economic context and governance structure. This paper compares the COVID-19 responses of Abu Dhabi UAE and Negrillan La Union. Let me just provide a brief overview on both location. Abu Dhabi is the capital of the United Arab Emirates, and it is a wealthy urban center with a diverse expatriate population and strong healthcare infrastructure. While Negrillan La Union is a rural community with limited resources and predominantly agricultural livelihoods. When it comes to their governance structure, Abu Dhabi employs a centralized approach led by the government authorities, while Negrillan operates within the framework of a decentralized governance relying on local officials and grassroots initiatives. The COVID-19 epidemic generated worldwide problems, leading countries to respond quickly to limit the virus and reduce its impact on public health and economy. This is according to UAE National Crisis and Disasters Management Authority. And we can see here that the Abu Dhabi and Municipality of Negrillan La Union offer contrasting illustrations of how varying socioeconomic conditions and governance structures influence reactions to pandemic. Let me begin by discussing COVID-19 in Abu Dhabi and the government's response. The United Arab Emirates recorded its first case of COVID-19 on January 29 of 2020. The patient was a 73-year-old woman, a Chinese woman from Wuhan, where the disease started. Health officials in the UAE did a contact tracing to find people who may have been in contact with a positive case and keeping possible virus carriers separated and isolated and stop the virus from spreading. And in response to the situation, the Abu Dhabi government implemented several restrictions and safety measures during the COVID-19 pandemic. And as of January 2020, after the confirmed cases, the Abu Dhabi government started checking airports and other port entry in order for them to stop the spread of COVID-19. Foreign tourists from high-risk countries are not allowed to enter, and tourists from affected areas were isolated. As more cases of COVID-19 were reported worldwide, in March 2020, the UAE government announced a plan to contain the virus. The government ordered closures of educational institutions and other places of learning. Public events were not allowed, and in April of 2020, the UAE placed a nationwide lockdown and limit movements to stop the COVID-19. Residents were required to stay home except when they needed food, shopping, or medical care. There's also limited public transportation, and businesses were optionally shut down. The UAE and the Abu Dhabi government enforced mask wearing, public social distancing, and limit the number of people in restaurants, shops, and other places. Any meetings or gatherings, it's either canceled or closely monitored. They did also have a public awareness campaign. The government taught people how to avoid getting COVID-19 by doing things like hand washing, wearing masks, and staying away from people who are sick, and doing social distancing. The UAE quickly conducted evaluations to identify and separate individuals who contracted COVID-19 or those suspected to have contracted the virus. And nationwide testing centers opened to make testing effortless for people with symptoms of confirmed cases. Additionally, facilities for treating COVID-19 were built, separation and quarantine. People who are tested positive for COVID-19 and close contacts were separated, isolated, that way to avoid any spread of the virus. This prompt and decisive action by the Abu Dhabi government in response to COVID, there are a lot of things that we need to remember. They have implemented stringent containment measure, wherein if people breach those lockdown or restrictions, they either go to jail or they will be fined a hefty amount of 50,000 dirham, and that is a $500,000 pesos. And with the robust healthcare system and their modern facilities, highly trained workforce, and state-of-the-art medical technology, it is one of the best things that boost how the Abu Dhabi government responds to COVID-19. The United Arab Emirates initiated its COVID-19 vaccination campaign in December 2020, marking the beginning of one of the most ambitious vaccination drives in the world. And after thoroughly evaluating the safety and efficacy data, the UAE government approved several COVID-19 vaccines for emergency use. And among the vaccines authorized were the Pfizer-BioNTech, Sinopharm, latter is AstraZeneca, and Sputnik vaccine. with Abu Dhabi UAE vaccination campaign, they did devise a comprehensive rollout plan to ensure nationwide efficient distribution and administration of vaccines. The plan is to prioritize frontline healthcare workers, the elderly individuals with underlying health conditions, and other high-risk groups. They did put up a vaccination center and in various locations, not only all over the Emirates, and among them there are 97 locations in Abu Dhabi. And also, the government launched an extensive public awareness campaign to educate the population about the importance of vaccination and address any concerns or misconception. Information about vaccine safety, efficacy, and vaccination process were disseminated through various media, social media, and community outreach program. And they also have online registration system in order to facilitate the scheduling of vaccination appointment. There is also walk-in appointment, and it is also accommodated in some vaccination center. And the government made COVID-19 vaccines available free of charge to all residents and citizens, regardless of nationality or residency status. This inclusive approach aimed to ensure widespread access to vaccination and achieve high level of vaccine coverage within the population. The government implemented robust monitoring and reporting mechanisms to track vaccination coverage, the adverse effects, and other relevant data. This information was used to assess the progress of the vaccination campaign and make any necessary adjustment to the rollout strategy. Overall, the UAE's COVID-19 vaccination campaign commenced with a well-coordinated approach, leveraging in their infrastructure, public awareness effort, and commitment to ensure equitable access to vaccine for eligible individuals. Abu Dhabi Economic Response. GADAN 21, also known as GADAN Abu Dhabi Economic Accelerators Program 2019-2021, is an economic stimulus and development program launched by the government of Abu Dhabi, the capital of United Arab Emirates. GADAN translates to tomorrow in Arabic, signifying the program's focus on future-oriented initiatives to drive economic growth, diversification, and social development in Abu Dhabi. And during the COVID-19 pandemic, the government of Abu Dhabi, UAE, took several economic actions to help the businesses, its people, and its residents. And these are some of the most important steps. Financial support for businesses. The government provided financial assistance in the form of grants, loans, and subsidies to support businesses facing reduced revenue and operational challenges. They also have the debt relief measures, introduce measures such as loan repayment deferrals, waivers of penalties, and debt restructuring for individuals and businesses facing financial difficulties due to the pandemic. Stimulus package. Roll out stimulus packages to boost consumer spending and support sectors impacted by lockdowns and travel restrictions such as tourism, hospitality, and retail. Job protections program. Initiatives were implemented to protect jobs, support employment, and upskills workers for emerging industries or remote work. This includes wage subsidies, job retention schemes, and training programs. Digital transformation acceleration. During lockdowns, many businesses have adapted to the new normal by accelerating their digital transformation initiatives. This has facilitated remote work, e-commerce, and digital service delivery, helping them to maintain operations. Infrastructure investment. The Abu Dhabi government is investing in infrastructure projects to create job stimulus, economic growth, and position itself for post-pandemic recovery. And there is also a sector wherein the measures were taken to help industries that were hard hit by the pandemic, and Abu Dhabi kept pushing for investment and economic development to boost growth and strengthen the country during the pandemic. To do this, they had to encourage businesses to back innovation and technology-driven areas and bring in foreign investment. And the target of Abu Dhabi on this time is, along with economic measures, Abu Dhabi also set up social support programs to help vulnerable groups such as low-income families and people who have lost their jobs or had their income cut. Help with this include money, food, and getting necessary services. Overall, Abu Dhabi economic answers to the COVID-19 pandemic were thorough and meant to lessen the social and economic effects on its people, residents, and businesses, while setting the emirate for recovery and long-term growth. Political implications. The COVID-19 pandemic affected Abu Dhabi government, public policy, and relationship with other countries. Significant impacts on politics are government authority and control. The pandemic allowed the government to demonstrate its authority and control over public health matters. Measures such as lockdowns, travel restrictions, and enforcement of safety protocols showcase the government's ability to manage crisis effectively. International reputation. Abu Dhabi's response to COVID-19 influenced its international reputation by implementing strict measures and effectively controlling the spread of the virus. Public trust and confidence. The government's handling of the pandemic impacted public trust and confidence. Effective communications, transparent decision-making, and swift action could strengthen faith in the government's ability to protect citizens' health and well-being. Economic management. The government's response to COVID-19 had political implications for economic management. Measures to support businesses and individuals affected by the pandemic could enhance the government's popularity and political stability. Social cohesion and unity. The pandemic understood the importance of social cohesion and unity. In times of crisis, the government's response aimed to promote solidarity among citizens and residents, fostering sense of national identity and collective responsibility. Abu Dhabi's solid social bonds and ability to bounce back from problems were praised during the outbreak. The government pushed for unity, education about public health, and fixing the social and economic issues that worsened the crisis. Leadership in politics made people trust the government and work together. The outbreak put Abu Dhabi's public and healthcare systems under spotlight. The government paid for hospitals, medical studies, and public health programs to prepare for health crisis. The public health and well-being were affected by political decisions about how to pay for healthcare, how to divide up resources, and how to build people's skills. And because of COVID-19 pandemic, Abu Dhabi had to rethink how it handles risks and prepares for disasters. The government made the country more resilient and improved emergency planning and reaction to prepare for pandemics and other worldwide disasters. Let us see how municipality of Nagilian responds during COVID-19. And although municipality of Nagilian, La Union faced challenges in its COVID-19 responses due to limitation in healthcare facilities, resources, and logistics, as well as the shortage of hospital beds, medical supplies, and healthcare personnel. I think this is already the challenges that was faced prior to COVID-19. And they also have faced challenges in implementing community quarantine and movement restriction to curb the spread of virus. This is because, as we all know, there are vulnerable groups of people that lost their job and there's no way that they can be able to procure food or provide food for their family. So this is also one of the challenges that Nagilian La Union faced during COVID-19. However, Nagilian La Union took a number of steps to stop the virus from spreading and lessen its effect on the community. Some of these steps, they did start a public health campaigns to raise awareness about COVID-19 and how to stop it, putting infected people in quarantine and isolation facilities, limiting travel and requiring screenings, helping vulnerable groups following health rules through local laws, helping businesses and people who have been affected financially, and working with national and regional health authorities. But what Nagilian's local government does rely on things like the number of infections, the healthcare system, and government policies. Nagilian's vaccination campaign, they also face some challenges because of obtaining and distributing vaccines, and the result in delays in vaccination effort. They have issues such as vaccine hesitancy and logistical constraints hinder immunization advancement, and initiatives to address vaccine hesitancy and build trust in immunization through information campaign. I think it's not only Nagilian La Union who has this kind of problem, but almost all over the world, people do have hesitancy. And I commend Nagilian La Union because most of the vaccine programs follow the rules set by the Department of Health and other health officials across the country. So the goal of this effort is to get as many people as possible vaccinated against COVID-19 so that the whole population is protected. It's possible that the campaign will include strategies like giving priority to high-risk groups, setting up vaccination centers, running programs to teach people about how important it is to get vaccinated, and making sure that everyone is in the town gets an equal number of vaccine. Local governments may also work together with healthcare workers, community leaders, and other interested parties to make sure that the vaccine programs goes smoothly. The COVID-19 pandemic has impacted politics in Aguilian La Union, Philippines. It transformed local governance. First, how politicians in that area are handled the epidemic has shaped public opinion of them and their party. Effective crisis management, such as responding fast and allocating resources, may boost a leader's image. However, perceived deficiencies might cause election-damaging complaints. Second, the epidemic altered politicians' aim and resource allocation. Local government have increased funding and staff for initiatives to aid the needy, improve healthcare, and boost businesses. This might impact government social services and infrastructure. Third, community involvement was required to implement public health measures. Government leaders and organizations have changed their public relations to gain support. The pandemic has closed business and cost many jobs. This has made the government feel like they need to support those facing financial hardship by distributing money and helping small enterprise. And finally, the epidemic may have affected the election. How the community felt about the crisis and how the government handled it may have affected how candidates conducted their campaigns, how many people voted, and what subject they discussed. COVID-19 has complicated politics in Aguilian La Union. These events impacted the town's governance, voting, and perceptions of its leader. Educational ramification. COVID-19 has had a major impact on education, changing present methods and developing future ones. Teaching students and future generation about COVID-19 requires several techniques. We must first address the pandemic's disruption of learning, including students' difficulties adjusting to distant learning and its effect on their academic success and well-being. Second, educators should teach about viral transmission, prevention, and immunization using evidence-based information from reliable sources. Instilling responsibility and knowledge for communal well-being requires public health awareness, conversation, including community collaboration and guidelines. Teachers can also encourage social-emotional learning by giving kids a place to vent their emotions, explore coping skills, and build resilience. Teaching about the pandemic requires exploring COVID-19's worldwide effect, pandemic history, and critical thinking to distinguish fact from fiction, promoting community participation, interdisciplinary learning, and lesson and reflection prepares kids for future health concern and build a more resilient society. These methods may equip students and future generations with the information, skills, and empathy required to navigate the COVID-19 epidemic and its aftermath. My final thoughts. What have we learned about the COVID-19? Reflecting on COVID-19 responses in the United Arab Emirates, especially in Abu Dhabi, and in the Philippines, especially in the municipality of Aguilian La Union, offers valuable lessons for the future. It underscores the importance of adaptability, innovations, and resilience in the face of unforeseen challenges. Understanding the strengths and weaknesses of different approaches can inform more effective strategies for managing future pandemic and other crises. Enhancing preparedness. Moving forward, there is a need to prioritize investment in public health, infrastructure, healthcare systems, and disaster preparedness. This includes bolstering healthcare capacity, improving disease surveillance and early warning system, and ensuring equitable access to healthcare services and vaccines for all segments of society. Third is promoting equity and inclusion. Additionally, efforts should be made to address underlying socioeconomic disparities and vulnerabilities that exacerbate the impact of the crisis. Building inclusive societies where everyone can access essential services, economic opportunities, and social support networks is vital to fostering resilience and reducing vulnerability for future shocks. Finally, global solidarity. Fostering global solidarity and cooperation is critical in tackling common challenges like pandemic. By working together across borders and sharing knowledge, resources, and best practices, we can better respond to crisis and build a more sustainable and resilient world for future generations. Maraming salamat po sa inyong lahat, and if you have some question or any further inquiry, please don't hesitate to ask me or send a message. Again, thank you and have a great day.